Liquid diets are a broad category of diets that can be used for a variety of purposes. It could be either partial or full meal replacement by either clear or non-clear fluids. A liquid diet is frequently prescribed by doctors prior to or after specific surgeries, especially for individuals who are medically obese. People also use liquid diet for fasting or losing weight. The very first uses of liquid diets date back centuries because ancient religious ceremonies often involved fasting, and many cultures served only liquids to sick patients. For decades, doctors have advised patients to follow a liquid diet before undergoing surgery. Several medically monitored weight loss procedures, such as Optifast and commercially marketed weight loss products, have only recently been available. When a person is extremely obese, a doctor may recommend a medically supervised weight loss plan that involves substituting solid foods with liquid substitutes. The liquid alternatives will typically provide between 500 and 800 calories per day, making it an extremely low-calorie diet. The liquid alternatives will also deliver all of the vitamins and minerals that solid food would normally provide. The liquid alternative is usually in the form of a shake. Patients are instructed to drink a certain number of shakes instead of eating each day, and to utilize that time to break previous food habits. Solid foods can be cautiously reintroduced after a few weeks of rapid weight loss and frequent appointments with a physician who monitors the patient's health and progress. The entire procedure is challenging and dangerous. It should only be done with a doctor's consent and under the supervision of a medical professionals. Usually, this sort of liquid diet is only prescribed when serious health risks linked to obesity outweigh any risks from the program. For weight loss, without medical supervision, liquid meal replacements have become commercially available. These products are not meant to replace all of your meals or solid foods. These products are designed to help dieters to lose weight rapidly, but they rarely result in long-term lifestyle modifications. Commercial liquid diet plan tells dieters must eat one normal meal during the day and replace the remaining with low-calorie smoothies. Each smoothie contains 1/3 of the daily nutritional requirements for a healthy diet. Most dietitians, however, still believe that a liquid replacement diet is not a suitable substitute for a healthy lifestyle. When you burn more calories than you eat, you lose weight. You will lose weight if you eat and drink fewer calories. Liquid diets takes advantage of this formula by substantially decreasing your calorie intake. Many liquid diet programs begin with a low-calorie intake of 400 to 800 calories per day. Extremely obese patients who lose weight on a medically supervised meal replacement liquid diet are likely to receive the most health benefits from a liquid diet. Obesity has been related to a number of major disorders, including diabetes, heart disease, renal disease, liver disease, and cancer. Obese people who lose weight have a lower risk of developing these diseases and can even lessen the intensity of their symptoms if they already have them. People who lose weight on a commercially available meal replacement liquid diet can also get health benefits. Anyone who has been prescribed a liquid diet as part of a medical procedure should know as much as they can about the specific guidelines and follow them to the closest. As a result, the therapy will have the best chance of succeeding. Anyone planning to fast should speak with their doctor and explain the nature of the fast so that it can be decided whether the fast will pose any serious hazards. Fasting should not be done for long periods of time by people who have health problems. Very low-calorie liquid diets must not be tried without close medical supervision. These are just for those who need to lose a lot of weight, usually more than 50 pounds, and who are having health problems as a result of their obesity. If you are thinking about trying a meal replacement liquid diet, talk to your doctor first to make sure it is right for you. Short-term liquid diets, used before or after a medical treatment have few dangers, and are typically regarded safe if the patient adheres to the given parameters and ensures that he or she consumes enough calories through juice, broth, or other clear liquids. Fasting for longer periods of time poses a number of problems, including intestinal damage, diminished liver or kidney function, and hypoglycemia. Fasting also weakens the immune system, making the body more susceptible to infectious diseases like influenza and streptococcus. Fasting can lead to weight gain because, while the body may use fat stores during the fasting, after the fasting is finished, the body normally rebuilds these stores quickly, and often more than was initially available. Short-term liquid diets, used before or after a medical treatment, have few dangers and are typically regarded safe if the patient adheres to the given parameters and ensures that he or she consumes enough calories through juice, broth, or other clear liquids. Fasting for longer periods of time poses a number of problems, including intestinal damage, diminished liver or kidney function, and hypoglycemia. Fasting also weakens the immune system, making the body more susceptible to infectious diseases like influenza and streptococcus. Fasting can lead to weight gain because, while the body may use fat stores during the fasting, after the fasting is finished, the body normally rebuilds these stores quickly, and often more than was initially available. Adverse effects can include gallstone formation, nausea, fatigue, constipation, and diarrhea. Depending on the brand, commercially accessible liquid diets also carry a number of disadvantages. Some diets are regarded very low in calories and are likely to cause malnutrition. Many do not sufficiently replace the vitamins and minerals that solid foods normally provide. This can lead to deficiencies that cause issues. For instance, if the body does not get enough calcium, the probability of osteoporosis and rickets increases.